what I would like everyone to get an idea of is what exactly is chronic fatigue syndrome and anything that you're dealing with as far as fatigue goes. And if you want to expand on that into other conditions, that's fine. But if can you give your view of chronic fatigue syndrome for the listeners?
Yes, well, at the very root, a patient will come and they're extremely fatigued. It's not just a week of fatigue or they've moved house and they're fatigued. It's debilitating and it's chronic and it's long lasting, and they can't get out of bed or they feel a brain fog. It is tricky to label it because it really is a large umbrella covering a lot of symptoms. But if you imagine it's fatigue, muscle pain, brain fog, inflammation, there's a lot going on. But the common thing is classic fatigue.
And what are some of the diagnostic challenges for chronic fatigue syndrome? And what are you looking at to sort of clarify that this is a fatigue case and
Yes.
and maybe even to categorize it as chronic fatigue as a condition as opposed to just fatigue as part of something else.
Yeah, it's a tricky one, as I said, but there is often adrenal fatigue, there's hormones playing in, there's long COVID, there's viral loading, etc. But when the patient's sitting in front of me, I'll just look at them. I prefer not the labels if necessary. I just want to get to the root of their problem and their fatigue. And I have a list of goals and questions to ask them. What do they want? And it's always give me more energy. I want less brain fog. And it starts with screening the basics. Is the iron low? The clinical case taking as well? Are they sleeping? Are they eating right? Setting the foundation. Then there might be a path to go off and look at microbiome, or there might be screening for pathogens. But little by little, we'll chip away at it. Will come along as a key area to focus on, and that might be microbiome. We might uncover a parasite, but there definitely will be something to work with, and that'll result in uplifting their energy. And that's the exciting bit because the patient often doesn't care about why. And they've already been on the run around and they've been told everything's okay. But clearly, that's not the case. They're exhausted and they can get more energy. The human body is amazing, and that equilibrium has been smashed out, and they just need to establish that equilibrium and get their beautiful body working the way it's supposed to and balanced and in harmony.
It's great. And we often hear a lot about, well, energy is a big component of fatigue, of course. And there's a lot of talk about mitochondrial dysfunction as well.
Uh-huh.
And how do you approach that? Because we're now talking on a cellular level. And what are your thoughts on that whole aspect of fatigue and chronic fatigue?
Yeah, it's multifaceted. There's the mind, there's the stress, there's the dysregulation in relationships, all of that. But as you are cellular, really the building block. So imagine the kitchen, you're cooking up a meal and you're working with what you've got. You open the fridge, there's nothing there. You open the pantry, there's nothing there. It's similar in the body. We really need the key nutrients. We need those Bs, we need the vitamin C, we need the magnesium, we need the zinc, etc. And there's a component of that slotting in the key energy producing nutrients in the cells. So the mitochondria is inside the cell and it's often termed the powerhouse, and it produces the energy and the Krebs cycle. But supporting that. And then on another side to the mitochondria, it's like the factory, the cogs, they're all clogged up with gunk and they just grind to a halt. And the whole system is getting burdened with waste and toxins. And then secondly, it doesn't have the cofactors and it's not producing the energy. So somehow helping that system, that little factory powerhouse to work and getting the system working. Now, there may be the cogs turning slowly at the beginning, but eventually we'll get the system running again, waste will be removed, and energy will be produced.
Great. And what about the HPA axis? Is that something you focus on as well when treating these
Really,
patients? And if you don't mind, can you explain a bit about that and what that
yes,
is
sure.
to the listeners?
Yeah, that's commonly talked about. I remember back 10, 20 years ago, time merges in, but the adrenal fatigue, it was thrown around. A lot of videos talked about adrenal fatigue, the cortisol, the depletion, but the HPA axis, hypothalamus, pituitary, adrenal axis, the hypothalamus is really key for controlling the hormones. And it just imagine it like a switch and then it wants the body to switch off because the system's not working. So your body's quite clever and it wants you to rest, but then we have things to do. So it's down regulating everything. It's bringing the cortisol down. It becomes exhausted actually. And that's what the HPA axis is.
Right. And what about treatments for individuals with chronic fatigue syndrome and people who've just suffering from fatigue in general? What sort of
Mm.
things are you using to treat these patients?
Yeah, it's a really tricky one. There are protocols. I like to avoid protocols. And I think that that's why we attract patients as a holistic practitioner. They've often been around, they've been to the doctor, they've been screened for their iron and they're not low, they've had their thyroid checked, they've been told everything's okay. And they may have even followed certain protocols, bring in the Bs, bring in the magnesium, bring in the glutathione or whatever, and it still doesn't work. And that's where we need to look at the patient and see what is it for them in particular. It's easy to have a protocol, but it's more important to look at specific pathways. It could be something in the whole picture, like their work schedule is at night shift. So therefore we work more on melatonin, or
Mm,
is it a gut protocol? Because even though we can search and find protocols with 30, 40 different products, it's unreasonable to think we're going to consume that many supplements or herbs.
yep.
It's much better to laser point what is it for that person and give them that. So, of course, I will share some herbs or nutrients with the viewer there watching, but realistically, it's much more effective for you to get that tailored approach just for you. So, let me think what would be the most helpful and safest as well, because
Mm,
it's better to consult a practitioner in case you're on any medications and they're going to interact. But a very safe one is N-acetylcysteine. And I like that one because it's helping the detox support through the liver. It's boosting glutathione because there's all that oxidative stress in chronic fatigue syndrome. And it's there have some studies on brain fog in particular. So that's a common one with chronic fatigue. It'll help with the brain fog. What else would I recommend? You probably need a B complex in there
mhm.
rather than specifically giving vitamin B12 or something like that. We would easier just for the viewer take a complex B. And what would be another one? Probably magnesium. That's a safe one. And that should
Mm.
help in a lot of cofactor uh, biochemical pathways. And it will help with the sleep. There's often better quality sleep will help with fatigue, which is
And look, and there's
possible.
there's so many, isn't there, that you can throw out a condition like that. Again,
Yes,
it all depends on the individual. I mean, you've got your adaptogen herbs, you've got carnitine, you've got even creatine would be something you
yes.
could consider. But there's many things that might be necessary for that condition for
Yeah, I forgot
various
about the
individuals.
herbs too.
Yeah.
Beautiful
Yeah.
herbs. But yes, the most common one is talked about everywhere, and I'm sure you, the viewer, has heard of this one, withania or ashwagandha. It's
Mm.
everywhere now.
All right, Shannon. So just to summarize,
Yes.
I I took in that we've got to treat the individual and not the condition, and it can vary a lot between one individual to the next. It's not something you can just throw a protocol at, and um, we often hear this in our field, a lot of cookie cutter protocols that are used, that everyone just gets the same treatment as the next person. And it could be the numerous things to work on, things like thyroid, the HPA axis, is
Mm.
iron levels right? And we've got to rule out a lot of these things too. And the another takeaway was the mitochondrial function, the energy powerhouse of the cells. So we've got to make sure we've got we're treating the oxidative stress if it's there, and optimizing, all the nutrients that the mitochondria and the cells need. Okay, is there anything else to add to that, Shannon?
Only that if you are watching this and you're struggling with chronic fatigue or long COVID, I just want to give you hope and keep on it. Keep believe that you definitely have the ability to heal, and don't give up because there are definitely solutions and answers to your fatigue problems.